The situation is particularly perilous in Italy, where for the second day in a row, more than 300 people died in a 24-hour span. The country has confirmed nearly 28,000 cases of COVID-19. Spain is quickly becoming the next global hotspot. More than 300 people have died in that country, with more than 9,400 people infected. Europe is now the epicenter of this pandemic, and the governments there are tightening border access. The European Union is planning to restrict all non-essential travel for foreigners to its 27 member states, although that ban does not apply to visitors from the UK. Some European countries have already taken their own stringent steps, barring or limiting entry to non-citizens. As our Europe Bureau Chief Crystal Goomansingh reports, countries like France are restricting the movements of its own people, while the UK is telling Brits to stop all non-essential contact.
A plea to UK citizens: do your part and stay home.
It looks as though we're now approaching the fast growth part of the upward curve, and without drastic action, cases could double every 5 or 6 days.
Legislation is not being used. Instead, the idea is that people will comply because they see how Europe is struggling with COVID-19. Thousands have died in Italy. Morgues and funeral homes are overwhelmed. At just one cemetery in the Lombardy region, there were 12 funerals in a 6-hour period. Spain is reestablishing land borders as it fights a rise in infections. Social distancing is key, but the World Health Organization wants more testing.
You cannot fight a fire blindfolded, and we cannot stop this pandemic if we don't know who is infected. We have a simple message for all countries: test, test, test.
Crystal Goomansingh, Global News, London.
The spread of COVID-19 has followed a predictable pattern. First a case or two, then some more, and suddenly a spike, which has led to the pandemic in more than 100 countries. Canada is now seeing a sharp rise, but there's still time to bend the curve back down. Eric Sorensen explains.
Canada is taking dramatic steps because the spread of the virus is dramatic and is learning from the experience of other countries that were inundated sooner. Measuring the number of cases day after day tracks the progress of COVID-19. For example, a steady increase, 10 new cases one day, 10 more the next, and so on, would show a straight line. But real life isn't like that. In simple terms, things are getting worse when the arc bends upwards. 10 new cases one day, 30 the next, then 60, and so on. But say the rate is 5 new cases, then 10, then holds at 10 new ones, and back to 5. There are more new total cases every day, but the rate is slowing. The curve starts to bend downward. Good news.
The days, weeks, and months ahead will be a test of our resolve, a test of our trust in science, and a test of solidarity.
China was the first to confront the outbreak with a massive surge in cases before shutting down Hubei province. The virus spread. South Korea was caught by surprise, but aggressively tested and saw results. Italy was slower, and it's still in trouble. Since mid-February, South Korea has managed to flatten the curve of new cases over time. That's the model for all countries. In Italy, cases began later, but soon surged, far surpassing South Korea. Canada has fewer cases, and the aim is to keep it that way. But right now, the rate is rising. On February 26th, Canada reported 12 cases. A week later, 34, and then 118. That was last Wednesday. And now, day by day, rising numbers to 341 on Sunday and climbing. That's why government, industry, and Canadians generally are rapidly changing behavior to flatten the curve. Eric Sorensen, Global News, Toronto.
We know you have lots of questions about the virus. Our Jeff Semple will consult with experts and try to answer them. So email us at yourquestions@globalnews.ca, and our website has a special page dedicated entirely to the new coronavirus.